Welcome, class. We are on neurology, and we're just going to discuss a few it's not a pathology course, but we'll talk about some of these diseases that are pretty common. Many people have family members or friends that may be dealing with them. So, Alzheimer's, for the most part, AD or Alzheimer's disease is sometimes used interchangeably with the word dementia. And it's when the individual loses the ability to rationalize or to reason. They also have difficulty with reading, writing, sometimes talking, eating, and walking. It affects somewhere around 11% of the population over the age of 65 in the United States. And it's when there's a loss of neurons that release acetylcholine. We know how important that neurotransmitter is. There are these abnormal plaques of protein that starts to form around many of these neurons, and they form what they call these tangled protein filaments, and they distort the neuron's function. Sometimes the risk factors are some sort of head trauma or head injury. There are some hereditary factors involved. They there's some new research out there that refers to Alzheimer's as a mitochondrial dysfunction when the mitochondria aren't producing fuel or ATP efficiently, so it short circuits the neurons. And there's other research that points to Alzheimer's being type 3 diabetes, not type 1, not type 2, but type 3 diabetes, which is glucose dysregulation in the brain, which then again results in poor mitochondrial function or a mitochondrial dysfunction. Some people, from a holistic perspective, have some beneficial effects of estrogen therapy for that. Vitamin E, which has some strong antioxidant effects, ibuprofen, some blood thinners like ginkgo biloba. But again, although these things are natural, it doesn't mean that they're always safe or that they should be used sporadically with other medications because they can result in some major complications, especially ginkgo, which is known to thin the blood and bring lots of blood and oxygen into the brain. But if the person is taking aspirin or baby aspirin or blood thinners, ginkgo could really seriously complicate things. In terms of aging, just through natural aging, there is a natural progression of loss of neurons. There's also the diminished capacity of sending nerve impulses to and from the brain. There tends to be a diminished ability to process information. As people age, there's decreased conduction velocity. There's also the slowing of motor movements. There's increased reflex time, right? If you've ever noticed that sometimes when you drive, if you get stuck behind someone that's older, people are honking, get out of the way, you're too slow, right? Because the reflex time is slowing down. It takes them longer to process information. There could be the degenerative signs of vision, hearing, sight, taste, smell, touch, and balance. These are all signs of neurological decline. In terms of brain injuries, there could be a displacement or distortion of the skull, like some sort of head trauma, where you can slip and fall and hit the back of your head or fracture any of those cranial bones that can increase intracranial pressure. There are brain infections. There's free radical damage that can happen when there's ischemia, which means decreased blood flow, right? Whenever you have decreased blood flow to the brain, even for short periods of time, there's the decrease of oxygen and glucose. That could be either a transient ischemic attack, which is short term, or longer term, a stroke. Concussion, when someone has a concussion, there's a temporary loss of consciousness. The individual can have a headache, they can be drowsy, a little bit confused, or even just lack of concentration. Contusion, contusions is when there's a bruising of the brain. And typically there is less than 5 minutes of loss of consciousness. But there's blood that's found in the cerebral spinal fluid. So whenever there's head trauma, if you see like clear fluid coming out of the ear, that could be cerebral spinal fluid. Clear fluid coming out of the nose, it could be cerebral spinal fluid, especially with contusions. A laceration is when there's a tearing of the brain, like if there's a fracture or a bullet wound, and that can result in increased pressure, intracranial pressure. And when there's bleeding in the brain and that bleeding starts to pool in a certain area of the brain, that's what they call a hematoma. It's a pooling of blood in a certain part of the brain. And when the blood pools, it increases pressure because it's hitting the skull. And this is why they will say, if you have head trauma, don't let that person go to sleep. Always, if they hit the head, if it's a skiing accident, an automobile accident, and they're tired and they want to sleep, don't let them, because they may not wake up. We've heard of these horror stories. Take them to the hospital right away and have them get some brain scans. Now, with the cerebrum, there's only two cranial nerves that originate there. Cranial nerve 1 is the olfactory, which deals with the sense of smell. And this olfactory nerve is zinc dependent for its function. So when there's zinc deficiencies, you may not be smelling very, very well. Here is the nose, right? Here's the nostril. These are the turbinates. This is the inferior concha, the middle concha, and the superior concha, or inferior turbinate, middle turbinate, and superior turbinate. And when you breathe air inside these turbines or turbinate or concha, they spin and centrifuge the air, and the odorants are going to stick to the mucous membrane and stimulate the olfactory bulb and the olfactory nerve fibers. The olfactory bulb and nerve penetrates through the ethmoid bone. You learn this in osteology, where in this part of the skull, you learn that there was an area called a cribriform plate, which is just perforated holes in the ethmoid so that the olfactory fibers can penetrate through. And this is why having clean hands is so important, because if you have a virus or bacteria on your hands and you wipe your hands across your nose and that bacteria works its way up and in, there's very little distance that that virus or bacteria has to travel to go from the nose into brain, because there's a direct connection from the cranial nerve 1 into the cerebrum. So you want to be really careful. Now, olfactory nerve, cranial nerve 1 is the first cranial nerve that develops embryologically. Okay, and then cranial nerve 2, this is the second cranial nerve that develops neurologically. So the cranial nerves are numbered 1 through 12, and they're numbered in the origin of their development. Cranial nerve 2 is going to allow you to see. It's going to supply the vision. So this one here was cranial nerve 1 for olfactory. The green one is cranial nerve 2. Look how close it is to the pituitary gland. That's the pituitary gland. Now, what's interesting about the cranial nerve 2 is that the eye does have receptors for vision. Those are called rods and cones, and they're embedded in epithelium. This right here is epithelial tissue, and they're held together by tight junctions. Now, if there's damage to the epithelium, these tight junctions become weak, they become leaky, and that can result in visual deficits or even macular degeneration, just like a leaky gut syndrome or an intestinal permeability due to the tight junctions of the epithelium in the gut being damaged. The tight junctions of the epithelium in the eye can be damaged as well, resulting in visual deficits. Now, this is an amazing picture because this one clearly shows if there's an object here, let's say this is the finger, right? And you're saying, can you see me wiggle this finger? This eye can see this finger, but this is in the temporal field. That information is picked up by the receptors, by the rods and the cones on the retina on this part of the eye. So when it hits this, let's follow these tracks. If we follow that green track, you see that it crosses over, it passes the pituitary gland, crosses over. Oh, it's going to synapse right there. That's your thalamus. And then from the thalamus, it goes to the primary visual cortex. Now, if I had something here in the nasal field of view, right here, that information crosses and hits the rods and cones of the retina on this part of the eye. And if we follow this tract and we follow it, look, it stays on the same side of the brain. It goes to the thalamus and then to the visual cortex on the same side of the brain. So each eye sends information to the same side of the brain and crosses over to the opposite. The same is true for the other eye. If I'm holding something here, that visual stimulus is going to cross and hit this part of this eye. That crosses over, synapses at the thalamus, and goes to the visual cortex of the occipital lobe. If I have something here on the nasal view, that crosses over to the receptors on the lateral part of the eye. And if we follow those tracks, that stays on the same side of the brain. Where those tracks crisscross, right in the center, we can see the pituitary gland. We see the pituitary gland right there in the center. So if this thing enlarges, it can put pressure on any of these tracks. Where they crisscross, we call that the optic chiasm. That's where they crisscross. So people can go blind. People can go blind on the outside of each eye. They can go blind on the inside of each eye. They can go blind on the right side of each eye. They can go blind on the left side of each eye. Or there could be total blindness of an eye. And it all depends on that pituitary gland and which tracks it puts pressure on. It all depends on where the nerve fibers are being cut off. Okay. Okay, we're going to pause right here.